Hello, hello. Just a minute. We're getting our live stream set up. Got some loud noises around here today. All right. Okay. So our question for today has to do with how soon can we step in and help other people who have been in our situation with narcissistic abuse. And I'm going to read the actual question so you all understand all the details of what was asked here. So do you think there's a certain amount of time of growth or healing or maturity that needs to take place before you can sit with another woman, to help her, sit with someone who finds herself in a narcissistic, abusive relationship, or just a woman that needs advice for a similar type of situation? So is there like a certain point in your healing or growth or a certain timeline at which you're kind of more equipped to help? Just a second, I'm checking my messages. Okay. All right. So I made some notes because this really is, and when I read the question, I thought this is a complex issue. It really is. And overall, of course, there's not, we can't put a specific timestamp on it, right? Like 1 year after the separation, or 2 years after the divorce was finalized, or 5 years later, on when you'll be ready to help others. We certainly can't say when you are totally healed. I'm a believer in the idea that our healing never truly stops, and that's because our growth as humans never fully stops. Like our personal development work is something that's ongoing. And I've shared before online that I think that is an exciting thing, a good thing. And many people can look at that as a bad thing, like, oh, I just want to be done with doing this work. Like I want to achieve this certain point where I don't have to do the healing work anymore. But I view it as a really good thing because it means that the possibilities are endless for us in our life and what we can achieve. Because once we set a goal and we achieve that goal, we can keep setting more and more goals. So I think it's a really exciting thing that our healing journey never ends. So kind of the same goes with, is there a point in our healing where we're ready to help others? We can't really put an exact timestamp on that. So I think, this, it's different for everybody. Essentially, it's different for everyone when they would feel ready to help others. So I want to get into just sharing sort of my timeline as an example, and then I'm going to share some more thoughts specifically to you all and kind of refer back to my story. So hopefully this is helpful just to share my timeline as an example. First, I want to say something I thought of a second ago is that I remember hearing right after my divorce that, so this is a timeline people try to put on recovery. So just from any divorce, just that grieving of losing that relationship, whether it was abusive or not, a lot of people say that it's like 1 year for every year that you were in marriage. So if you were married for 5 years, then 5 years later, I think this is specifically like when you'd be ready to like move on to a new like marriage or something. So I was married 4.5 years actually in the house with him, but technically married 5 years. And so that would mean 5 years of recovery, of healing. And I've crossed that point now. I'm coming up on 6 years since the separation. So for someone like me, that feels like, okay, that feels doable, right? But for someone who's been married 15, 20, 30 years, that doesn't make sense, right? So I don't think that we can put a timeline on it. I understand the reasoning behind that you don't want to rush things. And so for me, I decided that, and I'm going to talk about a few different kind of marks in my healing journey. So I decided, as far as moving on to dating, and we're not talking about dating here, but just to share kind of the full story of the time stamps I sort of put on myself, I decided that 1 year after the divorce was final was when I would begin dating. So not 1 year after the separation, but 1 year after it was final. So I was kind of counting down the days, honestly, and I ended up dating somebody right at that point for a couple months. You know, it was not something that was going to last. For a minute, I tried to fool myself that it was, because I really wanted that at that time. But I think that was wise for me to wait that long. And so that's just an example of how it can be different for different people. I know some people that went right into dating pretty soon, even after an abusive situation. And they found some healing and some freedom in just allowing themselves to go ahead and do that. So in a similar way, kind of it's unique to each of us when we would feel like we're in a kind of a healed enough place to help others. So for me, as far as when I got into this work of really being able to like make it kind of my job, or at the beginning it was like a side job, a side gig to help women who are recovering from abuse themselves, it was like 4 to 5 years. Initially though, I was in, let's see, around the time I was still going through the divorce process. So within like the first 6 months of the separation, probably a couple months after the separation, I started attending a divorce support group. And I found that there were many other women in particular, but some men who had been victims of abuse in their marriage in that support group. And we were able to help and support each other in that space in the group, even while we were all still going through it. One woman I really connected with, she had been married for 25 to 30 years. And, you know, it's like the story of she kind of wasn't allowed to have a job and had homeschooled her 3 kids who were adults by this point. And, you know, didn't really have much of a life of her own, or, you know, yeah, it was complicated, but basically she was coming from that perspective. And I was coming from the perspective of having at the time a toddler. She was 2 years old, my daughter at that time, and having just been, you know, with my husband married for 4.5 years before moving out. So very different perspectives as far as that. But we were both engaging in our own healing journeys in a lot of ways. She had been in a lot of intensive trauma therapy for childhood trauma as well that I had not been through, because I didn't have as much trauma to work through, but she had so much insight and experienced so much growth because of the intensive trauma treatment she had been going through. And then I had this different perspective as a therapist and as someone who had not experienced as severe trauma. And so I had my own perspective and healthy ways of looking at things where I could speak into her situation. And so I think, I guess kind of as I share my story, I'll go ahead and share my other points here because they go together. So I think that we can support one another on a peer level when we're going through the same stage of recovery, essentially. So I think it makes sense to have those people who get where you are. But also it's not just sort of commiserating with each other and complaining or venting together, but as you each continue to heal, you can speak into each other's lives and share and support each other in really meaningful ways while you're still healing. Let's see, so I'm looking at my notes. Okay, but first I think it is important to, well, not first, but kind of as you go along with this, I think it's important to assess how much you can give and in what ways you can give. So this comes down to like self-care, and you are going to have to do some trial and error. So it kind of is, you know, as you go. I had shared maybe a couple of weeks ago about kind of a marker to help you assess where you are in your recovery is to think about when you're sharing your story, like how emotional do you get? Are you really scattered still and things are really charged with emotion? You get sort of upset or just riled up, like your trauma is activated all over again by sharing your story, and it's hard to share it concisely? Or can you share it more concisely and with just some distance, some reflective distance, where not that you don't feel any emotion when you share it, but you can sort of concisely share the main points of your story, like I'm able now to do in these online arenas and with people that I meet in person who come into my studio. You know, I can share kind of the basic components of my story without kind of getting caught in the details and the weeds of everything that happened to me. And some of that comes just with time, like I don't remember all the details off the top of my head because there has been some more distance from those experiences with time. But also I've done a lot of my own healing work. So some women have been out of these abusive relationships for years and it's still fresh in their head because they haven't done as much of that healing work. So it's not necessarily just time. I do think that helps for most of us though. So that's one kind of way to assess kind of where you are. And there's no good or bad. It's just where you are. If you're still really emotional about things, and then maybe, maybe the best way for you to support others is kind of those who are maybe in a similar spot that you are, where they're still in that phase too, like I said, in that support group scenario, with those other women who'd experienced abuse as well. But if you're still like in that really, really emotional stage where your trauma is easily activated and easily brought to the surface, not only is that draining to you to then talk about it a lot with people or even hear their stories, right? Like hearing their stories can bring up stuff for you. And if it's making you feel more absorbed in your own trauma and activating your stuff to hear their stories, or you find yourself just needing to like share a lot about you in that time when you're really wanting to support them, then maybe that's too much for you with that particular person or too much for you at this time. And so just I encourage you to take care of yourself in that way. Like it's not wrong to say no, like I'm not the best person to help or support you right now, even though we've shared this same experience. Like I'm just in a place where I need to sort of protect my peace, my sanity, like my mental health, and not, and not engage in these conversations a lot. And you can recommend someone else to them, or that they go to a therapist, that kind of thing. Or it may be that you just have to limit the ways in which you support that other person, right? So you can be somebody that they could, contact online here and there. There are women that I exchange or I used to exchange, funny kind of memes or things that I saw online about narcissism, somebody just who gets it, right? Like you could be that person for someone, but maybe you're not the person where they can sit down and share all of their, the current drama going through the divorce or their co-parenting situation. If you're dealing with co-parenting, also like super stressful for you to hear other people's stories of what they're going through. If you're still really struggling with that and you feel like you're not really grounded or in a stable place yourself in that area. So maybe that there's certain ways that you can support them, or maybe you can support them in tangible ways. Someone going through a separation or divorce who needs, help finding housing or just different practical needs. They need a meal brought to them, certainly, as long as you're stable enough to provide those tangible things, then go for it, but with the things that might activate your emotions and your trauma, just be honest with yourself in assessing, is this more draining than it is, than really what you want to handle, right? I almost said then is worth it, but that's hard because you could tell yourself, as those of us with our codependent tendencies, you could tell yourself, oh, well, of course it's worth it. Like this woman really needs my help. But if it's draining to you and triggering to you, then that's not, the help you need to be providing right now. So this might sound like Jennifer's not really giving any kind of answer to this question, but really it's different for everybody. And it's just important to assess how much it's draining and triggering you. Also, last note on this part, I'm glad I wrote notes. They're along with that, you need to set some boundaries maybe with some people. Some people this could be indirectly done, like they just see by your actions kind of how much you're able to help them. But some people are going to be really needy, and again, coming from that codependent place, some people coming out of abuse, they might go right from being codependent with their abuser to needing to then attach immediately to someone else, and that person could be you. So didn't mean that to be so dramatic. That could be you, but But that can be really upsetting and unnerving to be on the receiving end of that. Like, oh, this person has just attached to me as like their person to help them right now. And that might be too much, even if you feel like you're in a really good, stable place in your recovery, that can be too much. So in those kind of situations, you probably do need to explicitly like state a clear boundary of what you're able to provide for them and what you're not. So boundaries can look like, the amount of time you can spend with them, the certain days that you're able to contact them, the way that you're able to interact with them. It might just be online, it might be just in person, and don't text me in between, but I think it'd be important if you're experiencing someone like that who is very needy to make clear boundaries, set clear boundaries with them. And okay, and so next, kind of along with that, is the other person, you really need to know that they understand the role that you are playing for them. And now this might, just a side note here, this might sound like too much detail. Like, of course we can just help a friend or help an acquaintance. Oftentimes I'll have friends send me a text or a Facebook message and say, hey, I have this friend going through this. Can I give her your number? Because, I know you've been through this and you could really help them. And it seems like, oh yeah, of course I can help them, but this can turn into a bigger situation, like more than you really bargained for in the beginning. So it's important to make sure after you set a boundary, like make sure they really understand your role. So this is where you might have to explicitly, like really state it clearly. You're not a therapist. You're not trying to be their therapist. And I know, many of us still have our own codependent tendencies, and so we want to help, right? And so there's a good level of helping that all humans should want to help other people in need. We should love and care for others and show compassion for them. But then there's a point where, like I said, it gets too draining or too triggering for you. And even if you still want to help, because that's where you're used to, because you have these codependent behaviors, this history of these tendencies, it's still important to know your own boundaries and what's going to be too draining. So you may even want to be their therapist, even if you want to be their therapist, like that's not your role for them. Okay. So to recap, we're all on our own healing journey, our own timeline. It's different for everybody. There are some ways that you can assess where you are emotionally. And unfortunately, again, this isn't like I can give you a test that's going to tell you exactly like, yes, you're ready. No, you're not. But just reflect on how much it's draining you, how much you're feeling triggered. And this is going to maybe be some trial and error where you slowly step into a friendship with someone who is going through this. But be honest with yourself and then be honest with them with setting boundaries and make sure they understand that role that you're playing for them, what you can and can't provide. And, if you're finding yourself either just naturally in this situation a lot, like people are coming to you asking for help because they know what you've been through, or if other people are kind of bringing people to you, if you're finding yourself in this situation a lot, it might be helpful to sort of have like a go-to little list of resources to refer people to. So, similar to like a therapist, if my caseload is full, or if someone refers a client to me who is not the best fit for me, like I had a phone call the other day, a mother leaving a voicemail about her daughter essentially having an eating disorder. That's not my specialty. And there are lots of great places in my area that can provide support to a teenage girl with an eating disorder. And, certainly I could see her and be helpful, but if I'm honest, there are many other people who could help her more. And so I asked some colleagues like, hey, who could step up and take this client? And I had many people reach out, and then it made me think I need to develop a list for all kind of different topics that are not my area of specialty, a list of resources and other therapists to refer them to. So if you're finding yourself in the situation a lot where people are wanting to come to you for help, it may not hurt to have just a few names of either just other people, like other friends or acquaintances, or therapists in your area who could help. It might be your therapist who you've seen and has been really helpful to you. You could refer them there. So, that's a way that you can help people, fulfill your desire to be there for others and help them without getting directly involved or without getting super overwhelmed and taking on sort of that therapist role for someone where that's not appropriate. And then I guess kind of to finish up, I got distracted and didn't share more of my story with this, my timeline. So I went through that divorce support group where I was supporting, peers going through this. And that was in 2016. And then it was in 2019 that I moved to the studio space I had before this, and started developing an idea for creating an online program for working with women who are recovering from narcissistic abuse. And I started I did a couple of small group workshops at the end of 2019, beginning of 2020, right before March of 2020, when things shut down because of COVID. And so that was, a few years after the divorce. And it was also at a point where I had been through quite a bit of therapy. I believe at that time, around that time, I was starting to revisit therapy. I went back to a therapist for just a few months and then stopped. But I'd had some big break. But I actually haven't attended therapy since then. I've done some coaching and other things. So I was at a point where I was okay taking a break from that trauma therapy. Like I was at a place where I felt stable to take a break from that. Doesn't mean I won't return to it. I'm sure I will. But in that place where I didn't feel like I needed therapy, I needed the support group. I had stopped going to the support group a while before that, quite a while. So I was just feeling more stable overall, like in my life emotionally. And again, I felt like I could share pieces of my story appropriately without getting too far into the details. And without getting too emotional myself and caught up in myself, I felt like I could really be with other women and support them and not be too triggered. That doesn't mean I'm never triggered. So that's a good point. I spoke a lot about you don't want to be too drained or too triggered. I do feel triggered. I do have clients who, therapy clients who share about the same stressors that I'm going through now. And that's, good in the sense that I can relate to them and have empathy for them, but it can be triggering or distracting. Had that experience last week and had to really pull myself back into the moment and not be thinking about my own stuff that was so similar to what this woman was sharing with me, so it still comes up, but it's not, it doesn't like ruin my day. There was a time where if I had talked to a woman and had to like hold my stuff in and not share my story while she was sharing all the stuff I heard last week, it would have set me off for the whole day, but now it's not so easily triggered. It's just a little bit of distraction. Okay, I got my feelings for a second and I can breathe and come back to this moment with this woman, and I don't feel like it's detrimental to my well-being. Okay. So I had gotten to that point where I felt like I could do that. And also gradually I was, like I said, you're going to experiment, kind of have some trial and error with what you can take on. I was experimenting with sharing, pieces of my story online, with sharing with other people and just seeing how that felt. And, I remember it was a really big step for me to say, I changed my signage at my previous studio space, a poster I had in the window, to say that I worked with, at that point I was saying domestic abuse victims and or survivors of domestic abuse. And that was a big deal for me to say that, because I knew if I was saying, yes, this is who I am, this is what I do for a living. And that point, it was just my side gig. I still had another full-time therapist job elsewhere working with children. But even as my side gig, if I was saying that and putting it on the sign, I knew that meant that I really had to own, this is who I am, this is what I've been through. And so it took a while. It took a while of sort of planning out my ideas for the online program, like behind the scenes, sort of feeling into that before I was comfortable like putting it on a sign. Now, most of you are not going to be in that position where professionally you're declaring like, I've been through this and now I'm helping other people going through it. But I think you'll be able to relate to that sort of phase of really being able to own what's happened to you. And like I said, have enough distance to where you can talk about it and not get so caught up in yourself and your feelings that you can't be there for somebody else. So yeah, that's just fleshing out a little bit more of my story. And on the topic of sharing our stories, I want to bring up I'll end on this, a very real A threat to that is if we have any sort of contact still with the abuser or still live in the same area, there could be some pushback to them knowing, hearing from other people or seeing things if we share about it on social media that we're claiming to be an abuse survivor, especially if there's anything that indicates that they were the abuser. And I can share this sort of privately here where I can't share on larger social media, but I'll just say I've had that situation very recently and it's not fully resolved, of figuring out what is legally, because I'm co-parenting with my person. So what is legally okay for me to share online? Can I say that I was in an abusive marriage, or should I just say abusive relationship? So if you look back, like on my Instagram, several months ago, I was sharing more detailed stories, not in super detail, and certainly not ever using his name, but I was talking about co-parenting and the fact that I was married and divorced and that kind of thing. And I've backed off because there was some resistance. So the abuser's still trying to control and limit my voice. And so that's something that I've been battling with. And it's, I should hear in the next week or two, like kind of the resolution of that legally, of what I can share. And so, that can be a scary thing, even if we think the abuser's not going to hear us talking about it. Like this person I'm sharing with doesn't know them, isn't going to interact with them, or maybe they're blocked on social media and we only share like a private post with friends, or even in a private Facebook group. Like that can still feel scary sometimes to really own, I am a survivor of abuse. I was married to an abusive person, to someone that I believe has narcissistic traits. To make those declarations, that can feel scary. And so I want to acknowledge that we don't have to, like, we can help others without moving into a way that feels like super vulnerable and scary for us. But at the same time, I really encourage you to just use your voice and own your story. And that's what I'm fighting for myself now, is I can share my story and my experiences. So yeah, I just wanted to put that out there, that can be scary, but I also want to empower you that to not be afraid to share your story. And of course, we want to be careful depending on what interactions you still have. Certainly, we don't want to put out, disparaging remarks just foolishly on social media. But if we're meaning to post or to have conversations with the intent of helping other women, then that's okay. Or just to share our own story, because that's a part of our healing process, to be able to share our stories. And so that's my legal stance, and what my lawyer is helping advocate for me is that it's my story, it's therapeutic for me to share it, and also my intent is to help other survivors of abuse. So want to encourage you and empower you that you can do that wherever you are in your healing journey. Despite my notes, I feel like this was a bit rambling. I hope it makes sense. Please feel free to give me follow-up questions to help clarify on any of this. You can send me a message or comment here on the video in Facebook. Thank you so much. And so Alex submitted this question and gave another great question for next week, which is pretty complex as well. So it's already got a question for next week, but if you've got more, please submit them, and I will tackle all of them. I love getting questions. It helps me tailor this to what you ladies really need here. So thank you, and I'll see you next week.